time it is, wherever you are. Hope you are doing great. I think for like 3 days now, I've not live stream on this app. Thank you for the views. I can see my watch hour is going up. Thank you. God bless you. Thank you. The new subscribers, the old ones, people that watch, people that comment. Thank you. God bless you. Please try to be liking. Don't just watch. Like it, and it will get better. Thank you so much. I appreciate you guys. So today I want to talk about fetal distress. Fetal distress. Oh, mommy, today I went out. It's not easy. Stress upon stress. No Lagos. So what is fetal distress? Let's start from what is fetal distress. You know, the midwife and the doctors, when you are pregnant, they always monitor your baby's heartbeat during pregnancy and labor to assess their well-being. Changes to your baby heart rate may indicate your baby is unwell, known as fetal distress. If your baby's heart rate changes, and the other time I made a video, I said the normal fetal heart rate is from 110 to 160 beats per minute. So if it's lower or it's faster, it's a sign that something is wrong. And fetal distress usually happen during the when the baby isn't receiving enough oxygen through the placenta. You know, if the baby is inside the mom, everything the baby takes is always from the placenta. So if the baby is not getting enough oxygen through the placenta, then the baby will be in distress. That's why we call it fetal distress. We also have maternal distress, but this evening I'll be talking about fetal distress. What can we say causes this fetal distress? Fetal distress may occur when a baby doesn't receive enough oxygen because of problems with the placenta, such as placenta abruptio or placenta insufficiency. You know, I said that placenta, the baby gets everything the mother takes in through the placenta, through the cord to the baby. So if there are problems with the placenta, the other time I talked about placenta previa, talk about placenta abruptio, anything that will make the placenta to be insufficient can cause problem. Or if there is problem with the umbilical cord, whether cord prolapse or cord around the neck, this could cause fetal distress. And it is more common if you are overdue, especially in post-maturity. That's when you can get this fetal distress, or you have pregnancy complication, or when there are other complications during labor. Sometimes it happens because the contractions are too strong or too close together. You know, the baby is in the uterus and the contractions start from the uterine fundus, radiate down. The baby is inside. If the contraction is too strong, you know, it can make the baby to go into distress. So that is it. It could be post-maturity during pregnancy, maybe pregnancy complication, then complication during labor, and sometimes it happens just like I told you about the contraction. And your baby is more likely to experience fetal distress if you are living with overweight or obesity. You know, normally anytime, in fact, most conditions, even if you are trying to do assisted fertility, maybe IVF, if you are too big, I don't want to say fat because it's disrespectful. If you are overweight, your doctor can counsel you that go and work on your weight, you know, go and slim down so that, you know, everything will go very well, because obesity comes with a lot of problems, hypertension, diabetes, so many things. So to be on the safe side, even for you, you know, to be in good health, you need to, you know, be in the average weight and always exercise, watch the calories you take in, and everything will be fine. Then if you have high blood pressure in pregnancy or preeclampsia, we call this a pregnancy-induced hypertension. You know, your blood pressure is always high, or preeclampsia, it can make your baby, you know, to have fetal distress. You have a chronic disease such as diabetes or cholestasis, a condition that affects the liver in pregnancy. All these issues could lead to fetal distress. You have multiple pregnancy, it can cause it. Your baby has fetal growth restriction, it can also cause it. So how is fetal distress diagnosed? Fetal distress is diagnosed by monitoring the baby's heart rate. Your doctor or midwife can do this. That's it's their duty to do this, to monitor your baby's fetal heart, and they can do this by intermittent auscultation, by using fetal hearts fetal scope to check and listen to the fetal heart rate. This means listening at regular interval using a device called handheld Doppler, and continuous monitoring using a cardiography CTG, that is in the antenatal clinic or in the labor room, just to monitor your baby's heart rates. A slow heart rate or unusual patterns in the heart rate may signal fetal distress. In this situation, your baby's heart rate is considered abnormal and you will need continuous CTG monitoring. They have to monitor your baby's heart rate, and for them to know what is really wrong. Your doctor or midwife might pick up signs of fetal distress as they listen to your baby's heart during pregnancy or labor. That's why when a woman is in labor, there's what we call, though I'm not in service now, but that time we used to use a pathograph to monitor the labor and the progress of the contraction and the baby's well-being. So if there's any deviation from normal, it will be attended to promptly. So when should I see my doctor or my midwife? Maybe you are feeling this distress. Then if the baby is not moving the way the baby moves, you should also go and visit your healthcare provider. Most time I do say it here that you are the one that is pregnant, you are the ones that knows how you feel, you are the ones that know where that shoe pinches you. So if you see anything abnormal, anything off, please go to your midwife and complain. There's no sin there. Talk, speak up. It's when you talk that we'll know the next step to take about these kind of cases. So when should you see your doctor or midwife? Your baby's movement are a sign that your baby is well. So a change in your baby's movement may be a sign of fetal distress. Maybe normally in a day you feel your baby move like 5 to 6 times, and now you are just he's just moving like 1 or 2 times, and it's very, the feeling, you are not feeling it the way. So please, you have to note this. So if you haven't felt your baby move or the pattern of movement has changed, contact your doctor or midwife immediately, as this may be a sign of fetal distress. Amnother sign of possible fetal distress is meconium in the amniotic fluid. The meconium is the baby's stool. So if it's seen in the amniotic fluid, is a sign that the baby is in distress. Let your doctor or midwife know right away if your waters are broken and you notice your amniotic fluid is green or brown. This could signal the presence of meconium, that is the newborn pool, that your baby may pass while still in your uterus if they are distressed. So when the baby is distressed, the baby can pull while it's still in the uterus, and this is one of the signs that the baby is distressed. So how is a fetal distress managed? There are a few ways that fetal distress may be managed. Your doctor or midwife will assess your situation and discuss with you the best management option in this situation. They will always involve you and your husband and your partner in this birth plan. They will look at the one that what is the best for you to have a safe delivery, for your baby to be alive and be healthy. They will know what to do about that. So you may be giving fluid through a drip into your veins. Sometimes changing position, such as turning onto your side, can reduce the baby's distress. So that's what they will first of all do. They first of all do all this, by setting up drip. Oxygen can be given to the mother to help the baby's distress. And you can also change your condition so that it can reduce the fetal distress. Your health team may give you medicine to slow down your contractions If you had medicines to speed up labor, this may be stopped if there are signs of fetal distress. Okay, maybe you're on induction, or even without that, they see that this contraction is too much and is causing fetal distress. They will give you something to make your uterine muscle relax so that the baby will be fine. Then sometimes a baby in fetal distress needs to be born quickly. Your doctor may recommend assisted or instrumental birth, or you might even need to do an emergency cesarean section. They will discuss it, the one that they know that it will be very fast, or it will help the baby. Because if the head is already down and the cervix is already fully effaced and dilated fully, there's no need to do cesarean section. So they can do assisted delivery or instrumental delivery, so that you don't have to go for CS. But if the head is still high, and maybe even the cervical dilatation is coming slowly and the baby is in distress, the next thing is for them to prepare you for emergency CS to save the life of your baby. So often there is enough time to discuss with your doctor or midwife. However, in some emergency situation, your doctor or midwife will need to act quickly if there are any medical intervention you object to, such as receiving a blood donation. It is a good idea to make sure that your doctor or midwife are aware of this when you arrive at the hospital or birth center. Like Jehovah Witnesses, I have them in my family. They don't take blood transfusion. So you let your healthcare providers to know that you are not interested in blood transfusion, so that they will find alternative for you to have your baby without having issue with any blood transfusion or whatever. So that is it. Does fetal distress have any lasting effect? Yes, babies who experience fetal distress are at greater risk of complication after birth. If not diagnosed and addressed quickly, prolonged lack of oxygen during pregnancy and birth can lead to serious complications for the baby. Complications may include brain injury, cerebral palsy, and even stillbirth. You see, this is one of the causes of cerebral palsy, that you see some children, they cannot live an independent life. So that's why when you feel that this movement is too slow for your liking, please go to the hospital in time. Whatever situation you find yourself, and you go and see the medical your healthcare provider in time, everything they will start the treatment in time, and everything will work out. So fetal distress may require assisted birth or cesarean. Okay, I've said that before. Having fetal distress in one pregnancy doesn't mean you will necessarily experience fetal distress in your next pregnancy. Every pregnancy is different. I've always said this. If you are worried about future pregnancies, it can help to talk to your doctor or midwife so they can explain that what happened before and during the birth. So that you have fetal distress in this pregnancy doesn't mean that you have it again. Pregnancy comes in their own unique ways. And I've always said it here that our bodies are different. Whatever experience you have as a woman that is pregnant is different from what Sister J will have. So stop comparing things like that. So if your labor didn't go to plan, you may experience difficult feelings about your birth experience. If you feel sad, disappointed, or traumatized about what happened, it is important to talk to someone. There are lots of people and organizations who can help. And I've always said this also, that don't keep things to your mind. Always say your mind, whatever you know that you need to know, or you want to know, ask questions from your midwife, and make sure that everything is okay. If your BP is high and you are giving drugs, please take it regularly as at when you don't just say I feel much better now. You just take it as maybe you were giving for 1 week or 2 weeks to take it judiciously. And then when they ask you to come for checkup in the hospital, make sure you go and do that. Always, please don't play with your antenatal clinic. It's very important at this stage, so that if there are any changes, your midwife will know, and they will know what to do about that. That's it for today. I will see you some other time. Have a blessed day. Good night, wherever you may be. Bye. Love you.